We are coming now to the last session of our first day, and I would like to invite Mr. Nahas Angula to come here, take a seat. Well, we know each other not very intensively, but as I have been always a supporter of Namibian independence when it was still a territory of South Africa, and me being a part of, well, the anti-apartheid activists here in Europe, but I've been often in Namibia in those days, helping to, well, to make also the German government, then I was in opposition here. I have been also in government, so I have gone through various positions in politics. But I'm very pleased that you are now here, that retired politicians, can have the chance to spend a day here. Anyway, yeah. Honorable Nahas Nangula, former Minister of Defense and former Prime Minister of Namibia, of course an old or long-standing member of SWAPO, who is now, who was the liberation movement and is now in government for many years. I'm very pleased to have you here.
Thank you.
I am now calling upon Peter Mahal Dieu Akat. Peter Mahal is Director General for Rural Water Supply and Sanitation in the Ministry of Electricity, Dams, Irrigation and Water Resources from South Sudan in Juba. And he is sanitation and water, well, SWA country focal point and previously SWA steering committee member. Warm welcome again. We have heard you already today, but you will also speak tomorrow. So the audience will listen to you more tomorrow. I call upon Matthias Mogge, Executive Director Programs from the German Agro Action. I don't know whether this is still the correct English translation. Yeah, Welthungerhilfe, of course. But okay. When I was in East Africa 25 years ago, you were known in Africa as German Agro Action, but it's a long time ago. It has, yeah, you are now better known. Okay, I acknowledge this. Then I call upon Lawrence Haddad. Of course, you know Lawrence already, so I don't have to introduce you anymore. Well, with this panel, I am very disappointed that I have to leave 5 minutes before 5:30 because I have to catch a flight to Berlin. So I will then hand over to Thilo, but I'm very happy to introduce you and to start with you. Well, my first question would be, well, after such a long and intensive day and really rich debates, how do you assess this day? What would you, if you are asked, was it worthwhile to come? What did you get out of it? Can you carry something home with you? Did you learn something new? What would be your overall assessment, Nahas?
Thank you, Dr. Aid, and thank you for
Call me Ushi.
Your solidarity and support during those very difficult days. We are now 25 years old as an independent nation.
Yeah.
I'm great to be here, and I thank GIZ for assisting for me to be here. Let me also express my sympathy to the German nation for the loss of your old chancellor. My sympathy, please. Yes, it was a long but productive day. The information we received were very educative, in my view, and informative. I want to paraphrase Mr. Canning and I apologize if I am not paraphrasing him quite well as he meant. If I understood him clearly, he said sanitation is more than nutrition, and nutrition is more than sanitation, meaning that the two actions must converge in complementary manner in order to make impact on the type of human agency we are trying to address. But it's very, very important to keep focus to the human agency itself. That's the question of health, that's a question of dignity, and that's a question of welfare of human beings. In terms of health, of course, we want to make sure that child mortality becomes history. If we can improve both sanitation and nutrition. In terms of dignity, we want to ensure that if we can improve sanitation, we also improve the dignity of our communities. In terms of welfare, if we can improve both sanitation and nutrition, then we have also improved the quality of life of people, meaning that we have also addressed the question of absolute poverty in our communities. I think these messages are very important, and my only appeal is that we should not try to compartmentalize things. Let us think about people we are serving, their welfare, their needs, and of course, their quality of life, through the improvement of sanitation and the improvement of nutrition. In that way, we serve the people, not the concept themselves. Let us personalize, let us put a human face between these concepts. Thank you.
Yeah, so thank you. Peter Mahal, what is your resume?
Thank you very much, moderator. First of all, I should be appreciative to the fact that I come to this very great country for the first time. So I thank the German Toilet and the network for inviting me for this very important interactive meeting. Secondly, this meeting is really timely. For me, it is timely in two aspects. One aspect is that we are starting the Sustainable Development Goals that have just been declared this year, and South Sudan that missed to be part of the MDGs formulation and implementation. We are now part of the SDGs, so we are starting scratch with other countries. And this workshop, bringing both nutrition and WASH together, is a great achievement. So for me, it's a milestone, and I have learned a lot. I may not rephrase like the former speaker what have been mentioned during the presentations, but the only takeaway from these sessions for the whole day is that we should not look into what is in our pocket. We should look what has been given to our communities. Saying, if we are implementing the nutrition in our countries, or we are implementing WASH activities in our countries, we don't look into what is the money that I need as an institution to implement as me. but rather I should look into the output, the outcome of this implementation. So the sectors, both nutrition and health, which is still is under domain of health to my understanding in my country. It is not a standalone institution or the ministry with a budget. It is still an output. It is not yet given the consideration like the sanitation. So I could say WASH is better standing and it can stand its own ground to get the budget to implement. But there is a need to link these resources for the output. The population, the communities that we are serving is what we have to look at. Not looking into our own institution and our pride as institution, Minister of Water or Minister of Health. So we have to look what is the benefit for our children, what is the benefit for our mothers and sisters and daughters. What should be the outcome for them? So but the presentations that have been given, they are really highlights that I should take back and also educate the rest. It is very important that we have to understand why are we implementing this service delivery. So this is my takeaway. Thank you very much.
Matthias Mocke.
Yeah, thank you very much. I would like to bring into the room a little bit an organizational perspective. Yeah? I think it was a wonderful, very, very good day already. But I think overall, we still have to go quite a long way. And we in Welthungerhilfe, just to give you this as an example, we have just started maybe 2 years ago, yeah, in being really reflective on the need to have a more sort of integrated way of looking to WASH and nutrition. And we all know that both sectors need highly professional people. Yeah, these are both sectors which are where you need a lot of knowledge to do good work. Therefore, we have formed kind of sub-teams in order to foster joint learning, joint programming, to have better outcomes, exactly what you have mentioned. Just to give you this as an example. In the countries we are working, we see very often that ministries, but also local administrations, are quite far away. I was happy to learn that there are also good examples, but we have quite a lot of examples where we are far away. For example, we are implementing a WASH project, urban WASH project in Ethiopia, and we are working with the Urban Beautification Authority. Yeah, they are in charge. So discuss with the Beautification Authority nutrition and WASH outcomes. Yeah, not easy. Yeah, but this is reality. This is where we work. Yeah, and another example, and it's good that Peter, you are sitting next to me, in very fragile and very difficult environments. Yeah, again, to whom do you talk to? Yeah, who are the authorities? Authorities very often are changing all the time. Yeah, so these are the challenges we are facing. I think we need to take donors and governments on board in this discussion. I think this discussion maybe just has really started, and the SDG process, I think, gives us a big chance, and reminding donors, governments in general, of the rights framework there is already, yeah, beyond the SDG framework, and that we now have to get much more to the rural areas, to the places where we haven't been in the whole MDG sort of time, yeah, because there we tried to, and this was also an outcome of the discussion now, where we tried to get the low-hanging fruits. Yeah, now it's getting more difficult because we want to have zero hunger, we want to have everybody having access to clean and safe water, etc. So that's the real challenge, I think.
Thank you, Lawrence. What do you take home?
Thank you. So the first takeaway is I'm surprised at how much I didn't know about WASH. I really learned a lot about WASH, and I'm even in one day. So again, congratulations to organizing this event, because it's unusual. I think it's the first WASH event I've been to, or the first event with lots of WASH people I've been to. So,
Yeah.
So, and it won't be the last, don't worry. So I've got 4 differences that I've observed between the two communities and 4 similarities. So the differences, one, in the WASH group community, there seems to be kind of a hardware and a software component to it. There's like big spending on big infrastructure projects, and then a lot of behavior change stuff as well that has to happen. And in nutrition, we don't really have that kind of a thing. And I don't know whether that is an important difference, but I want to reflect on it a bit. Second difference is, just from talking to people in the coffee breaks, it's clear to me that water and sanitation seem to be more of a preventative kind of approach. We need to get this stuff to everyone, whereas malnutrition has preventative, nutrition programming has preventative dimensions, but also treatment dimensions. So that may not be a difference. It may just be my lack of understanding of water and sanitation side, but I think that also generates differences of approach, perhaps, or sequencing or prioritization. So I thought that was interesting. In our small group meeting under Group 1, it was clear to me that the nutrition community tends to prioritize different age groups and different stages in the life cycle, whereas I don't think, from what the WASH colleagues were telling me, that's not necessarily the case in WASH, and I thought that was an interesting difference. And then the final difference was really in Katarina's presentation. I was just kind of blown away by the fact that you guys can get a bunch of ministers of finance in the room to talk about water and sanitation, because nutrition community would dream about that. You know, that would be amazing. We can get maybe 2 levels down from that. So that was interesting. But there are lots of similarities. So one of the most basic similarities, number one, is that we both rely on the same sets of surveys very often, these DHS, MICS surveys, mixed surveys. And, you know, can we come together around some efforts to get those surveys to be more attuned to the things we really care about in the SDG era? We're always trying, as a nutrition community, we're always trying to get those surveys to do things differently, but we're very small voice. You know, DHS are always getting, loads of people are asking them to do things differently. If we could ally with the WASH community, maybe we could do some things around water quality, which is important for you and it's important for nutrition. I hear lots of things from my nutrition colleagues that the water, access to improved water, it's not really improved water. But it's grumblings. There's no serious research behind it. That's my first similarity. Second similarity is both revolving around behavior change. I mean, nutrition is a lot about behavior change, and water and sanitation and hygiene a lot about behavior change. And it's easy to forget that about the water, sanitation and hygiene community. So building more toilets is maybe not even necessary, certainly not sufficient, but it's helpful, but it's only helpful if there's behavior change component behind it. Third commonality was we're both interested in health outcomes, obviously, public health outcomes. That's our ultimate goal. And we reflected on that in Working Group 1. But my fourth and final similarity is I think there is just a comeback to the incentive issue again. I think we're enthusiasts, we're excited today, right now, we'll be excited tomorrow, but when we go back to our day jobs, reality will hit. And we'll have to deal with all the emails we've missed and all the meetings we've missed and all the people we need to talk to. And working with another set of people on another set of highly related but slightly different set of issues will hit us. So reality will hit. And so I just think the central issue is how can we make the incentives work a bit better so that we can collaborate more strongly.
Well, thank you. Well, thank you very much. I also have to underline, I learned a lot. I was very impressed by the whole discussion today. I have to say goodbye. I'm leaving now. Please excuse me, I felt honored to be with you today. I hand over now to Thilo Panzerbieter and just continue. Yeah, don't feel interrupted. Yeah. Okay.
I will interrupt just very shortly as you're packing. Yeah, I want to thank you very much, Uschi Eid, for doing this with me in this way today. And when you said before that you have to leave, I was saying with very good football or soccer players, they do the same type of thing. They sub them out just before the end of the meeting so they can get a big round of applause. And all the best for your meeting. All the best for your meeting next week. No, we'll be in touch. Don't worry. So it's now the pressure is solely on me to sort of lead through the rest of today, and thank you for the comments that you have already made. Lawrence, I love sort of the similarities that you've also pointed out, because my sort of second question that I wanted to ask, and no pressure on any of you to have to answer in any particular order. We'll just take it with a raise of hands, and would be give us some guidance for tomorrow. We have you, and I will let each of you think about it first. If you have something to add, great. Otherwise, in a second, I will also open it to the floor. Because tomorrow we will hear, on the one hand, some country cases. I think we'll have a comparison of a country, South Sudan, where you have sort of this issue in two different ministries, where in Burkina Faso we have it in one. We will hear tomorrow from civil society, the networks there advocating for this. What do they ask and demand? We will hear from donors. Have I missed a mirror session? I think I have one. And potentially, this is a question, if we receive sort of the second video message, we'll be able to touch on human rights also. But we do have an open block in terms of, what do we discuss? How do we take away specific takeaways? So my question would be recommendations from any of you. Which thing do you think we touched upon today that needs to be further elaborated tomorrow? Incentives I'm hearing from the floor. Just if you have some thoughts, great. Otherwise,
well, I'd like to hear from the participants about what they think are the biggest. Are they more optimistic or less optimistic about collaboration, and why? But I mean, I'd like to hear that.
Okay.
I think it's really important to talk about the really difficult issues.
Mm-hmm.
So
Okay.
And be really realistic about it.
Okay. So now we're having the panel ask questions to the floor. It's great. Please get the roaming mics ready. We'll take 3 questions of the panel to the.
I would just like to
No, please, Matthias.
add, because I had a similar idea. I think we are not in an ideal world. Yeah? We are in a very complex and often very difficult world. And I think one recommendation for tomorrow would be also to talk about the very difficult areas or countries where the problem is probably the biggest. Yeah? And not to forget these difficult places like Syria or like South Sudan or like Afghanistan, where access is very, very difficult. But to talk about and think how we can get to better outcomes in these kind of difficult settings.
I think for tomorrow's meeting, since we're going to listen to the specific case and some comparison that we will be exchanging on our aspects or our context, it would be also preparing for all of us for tomorrow's better come with a good suggestion that could help this forum to go with as a takeaway, the whole forum, because we will see what is the aspects of the each context or each institutions and what could be the best takeaway for all of us when we go to our countries. So is a suggestion, is thinking of what should be the takeaway for all of us in terms of implementation. Is it a case of Burkina Faso, or is it the case of different institutions dealing with the wash and nutrition? So, yes, for thoughts.
Excellent. Thank you, Peter. Would you like to add anything from...
That's my new name. That's my new name.
Excuse me. No. Excuse me. I said thank you, Peter, and then I said whether you would like to add.
Yeah, thank you. Oh, I thought,
no, sorry.
I thought Peter is my new name.
No.
Oh, next time.
Of course not.
Yes, as I was introduced, I've worked in government for quite a period of time in different portfolio. And one of my frustration in government has been how do you reach a household as a government? A household. Is it easy to build a road or airport or whatever it is? But if you are talking about sanitation, you are talking about at the household level. How do you reach there as a government? It's very difficult. So that's why I took interest in non-government activities in this area. Think that perhaps we have to strengthen the capacity of non-government actors to be able to reach households and work with them. The second issue is the question of capacity. We have a challenge of capacity in our part of the world. And my question is, how do we build up capacity, especially for the civil organizations to be able to mobilize the communities, the households, in order for them to be part of the change we desire. Then collaboration. Are there pathways for collaboration to strengthen capacity in our part of the world? If we find time to look at some of the things, I will be happy. And at my tender age, I will leave Germany happy.
Thank you very much, Honorable Nahasangula. We will, I think, one of the things we were looking at doing tomorrow is actually also focusing on capacity building as one of the potential issues for one of the workshop sessions. And now, maybe if it's okay for the panel to also open it to the floor, to either comment on things that have been said before, or as Lawrence just said, to answer. Yes.
Thank you. Lotte Feuerstein from the Water Integrity Network. Just one thing that came into my mind for the workshop sessions based on the discussion we had during our group work, because we kind of slided sometimes from the global goals into programming, because probably that's also a bit more, or something that is also very relevant to the kind of organizations we come from. So I think that could be something for a joint for a workshop session to look at, what could be like the higher, ambitious goals for joint programming, but what could also be small, very pragmatic steps. And I don't know where, but one other thing we could do is maybe look a little bit at from what kind of organizations are actually the participants, because I don't know, but if there are a lot of people from research, maybe this is also something where, relevant research gaps on the interlinkages are.
Thank you. I think we have 2 more hands. Yeah, and then Abigail as well. Johannes.
Yeah, Thilo, just a comment from my side. I was a little bit disappointed about the mirror sessions because I had the feeling that there were, again, these sectoral silos. Everybody, the one side reported what they are doing, the other side reported what they are doing, and I missed a little bit thinking out of the box and linking the things. Give you an example, for instance, when the cluster leads were sitting together, it's easy just to maybe invite the others for their global WASH cluster meeting, or Sun could invite somebody from SWH for their meetings. Just simple like that, something like that. Yeah.
So you're saying more practical, small gains that...
And also maybe it cannot be, maybe it's not realistic, but just thinking out of the box how we can link or integrate both sectors in practical terms.
Thank you.
Okay.
Abigail?
It's not me? Okay. Is it speaking?
It's the red microphone, I think. Go ahead, speak.
Hello?
Yes.
Yeah, now it's fine. Okay. All right. Thank you very much for the opportunity. Abigail from Zimbabwe once again. Right. Before I go forward with my question, I'm quite worried with the comment from the Honorable there. When you are saying you've been in government and you're frustrated because of the issue that the government cannot reach the people, are you reliably informing us that government is quite different from the people? Government cannot reach people. Then who is government at the end of the day, from your perspective and experience? And I also wanted to allude to the issue of using nutrition data. I think our movement, the Sun, now that the global whatever secretariat is here, can guide us ahead of collaborations, probably with the statistics of saying the most affected countries maybe are starting from the least or the most, so that as collaborations are going forward with the other colleagues, we know which geographical areas are we targeting as a way going forward. Thank you.
Would you like to reply to it, please?
Yes, perhaps I didn't...
It will come on.
I didn't make myself clear, Shamwari. What I'm saying, government is not likely to come to your house and dig a toilet for you. It's not likely to do so, because it will be obliged to go to every house and dig a toilet for every house. It's not possible for the government to do. But you, as a civil society, you can invite those who want to be assisted to work with you. You can afford to discriminate on certain basis, but government cannot afford to discriminate. If you do something for this one, you should also do it for that one. That's what I'm saying.
Maybe I could add a little bit. He said he is out now of the government. He is now of a civil society support. Somebody who is still fresh with the government. I could add what should be done as government to reach the people. You could adapt better strategies that can reach out to each an individual household as government. But you do it using that strategy. That is why now in our status of South Sudan, we try to dig toilet to each household by advocating, by using and adapting what we call community-led total sanitation, which is very simple, and it generates the demand by the communities themselves, but the government back it up and use the CSOs, use the organization that can help to roll out this community-led total sanitation, and then they are already doing their job, and it is the same government who is doing it. So not necessarily that I go and dig a toilet in the house of Mr. X or Mrs. X. In this way, I have already dug a toilet by advocating and make everybody know that this is very important. You do it by yourself, and if he is aware of why is it important to dig a toilet for your house, then you have done it as government.
Thank you, Peter.
Okay.
I will hand over the word to Josephine.
Yeah, I think what would also be useful is just following up on what Lawrence said. In a number of countries, before coming here, I read a lot about, what is happening in a number of UNICEF regions in WASH, the link between WASH and nutrition. And there's a lot of work around how countries have influenced policy decisions so that there's strategy at country level to link, even if there are two ministries, how that they went from that stage to having a strategy in place and then working together, defining the package of intervention and so on. So I really think that maybe what will be useful is building on the work of the group that worked on policy guidance and so on, practical examples from countries, maybe not in this forum, but really collating that, because I think that will be a useful thing to guide. It's not just about the implementation, but also the policy framework in these stable countries that guides this work. I think that needs to be taken into account. Can I say just one little thing? On the mirror session, I must admit, because I was in one of the mirror sessions, we were given a guidance, and that's what we work from, So, indeed, maybe practical example of interventions and so on is something which we could focus on. But I think really the presentation made by Lawrence and a few others clearly tells us what those interventions are. So it's more emphasis on the how. How has it worked in country X? How have we, worked together? And I think we could build on that more, because this is, as we say, just a beginning. But I guess there's much more we can build on that.
And I am a civil engineer, so when you talk about building, I know what you speak of. And when you build a house, you must build the foundation before building the other floors. So I from my side, want to thank everyone today for the participation. As I said this morning, also for some of your patience, because half of the presentations may be things that you have known before, but I think we've heard from many also learnings we take away from hearing something about the other sector, which may seem very basic, but we understand how it functions, what are the goals it aligns with, what are the global trends, where do they come from, what's the history of getting there, how do you coordinate today. But what I'm sensing in your intervention, where we're actually talking about digging a toilet and how now bringing it to the people, when we speak about more practical approaches or how to link the different sectors, I think that's sort of the takeaway I would take, that we've now reached this point. And as I said this morning when we were looking at the equation, day one must be we have a common vision. We've all come here with the same sort of dissatisfaction of perhaps not linking. We've now come to a common understanding and perhaps a common vision of where we want to go. And tomorrow it's definitely part for that third section of taking the first steps. And we've heard some of those things already today. I'm happy to see that the board outside is actually filling with cards as well, of people sort of pinning things up, and they can be anything from larger to smaller issues. From the things we've heard from the panel and from the floor, I've heard a lot about sort of practical examples from countries about pragmatic steps we want to take to come forward. We've talked about capacity building. I think tomorrow there should also be the room to still keep that one group working on humanitarian issues as well, looking at that different perspective. But tomorrow we did intend to look more at the specific small decisions we can make as organizations in the way we program, in the way we work on the ground. So tomorrow I think we'll talk more about explicit decisions for how do we target, How do we make decisions and work in projects? And looking more at those practical approaches and taking into account, I think there is an intervention over here, also looking at who are we in the room. I think it's a huge benefit to have someone who's now engaging from a civil society perspective in something with this experience that you bring along from sort of having that that position in government and knowing perhaps no one better than yourself probably knows what can be expected of civil society or which role we should take on. So with this, I look forward very much to tomorrow. I would like to ask for a big round of applause for our panel, please. And we are very open from our sort of core team of organizers also for your comments and suggestions. I would basically say, Johannes, if you quickly stand up, please, concerning members interested in humanitarian issues, for shaping tomorrow, who will facilitate groups and so on. Please do see Johannes. Concerning more the targeting, how do you do your interventions perhaps as an organization in such a practical way for where you choose your interventions, how you decide what you do. Robert, maybe. Would you stand up for sort of more those targeting type issues and practical approaches? Please do see Jan about sort of capacity issues. Come to me if you have other ideas for tomorrow. Do approach us. This is supposed to be a working environment for us to shape tomorrow together. So, thank you very much for that first day. Do add comments to the wall outside, and it's my pleasure to finally announce one break or sort of food event upstairs where I don't have to be running around in 20 minutes to telling you to chew more quickly and please come downstairs. Enjoy the food and drink, network with others, and like I said, give us inputs for tomorrow if you would like to do so. Thank you very much for this first day. Okay, thank you. Thank you. Okay.